Thank you so much to Phil with that weather update. Let's take you back to the Cape Town Convention Centre where Leanne is this morning for the 17th World Conference on Tobacco Health, which is WCTOH. Leanne, it's a very good morning to you. So the conference uniting the world for a tobacco-free generation.
Yes, hi, a very, very good morning to you, Palesa, and to everybody else that's tuning in for this live broadcast from the 17th World Conference on Tobacco or Health. It's quite a big statement there. I think a lot of people are asking, what kind of a title is that, Tobacco or Health? Well, if you ask the question, that's exactly what they're doing in that title. You choose tobacco or you choose your health, and that's the reality. So this is the first time that South Africa is hosting this particular conference. We're expecting about 3,000 delegates to arrive here and participate in this, and it's a very high level delegation of individuals that are coming, that are working I think feverishly in this industry to try and educate people about the dangers of smoking and how difficult it is for countries to deal with this. I mean, you know, I was having the most fascinating conversation off air when it comes to smoking, and the reality is that here in South Africa we're actually developing new strains of cancer due to the way that tobacco is being smoked. I mean, if you think about the way that Nuape is smoked here in different regions, and everybody has their own different recipes, but the reality is you're mixing Ratex, you're mixing ARVs, some people put Tikian, whatever else they can put, and then it is put through, it's vaped through wine. So these are things that the lungs are just not used to, and the reality is that these strains are coming in fast and furiously, and people are dying, and they are dying fast. So this is what this conference is all about, is to try and find mechanisms to educate people to stop smoking. And it's not only about those cigarette boxes, it's also about those illegal inflows of illicit cigarette trades, and also the tobacco that is so freely available. Well, I'm going to talk to a representative now from the World Health Organization that'll perhaps shed a little bit more light about the world and where we're at right now when it comes to smoking and the education drives. Paul Garwood is the communications officer from the Director General's Office of the Department of Communications from WHO. Good to have you, Paul. Thanks for chatting to us.
Thank you. Thanks for the chance to join you today.
I mean, you know, some of the things that I've been hearing have been blowing my mind. I mean, I've been fully aware of the dangers of smoking, but I haven't been that educated when it comes to the fact that there are new strains of cancer, there are new strains of people dying from all forms of ways that tobacco is being used.
Yeah, this is one of the major challenges of tobacco in countries like South Africa, where huge gains have been made in improving health and so many other fronts. Tobacco comes along and pulls all those gains back. I mean, it's an avoidable product. It's an avoidable way of it's an avoidable cause of death in so many cases. But the industry is so pervasive. Its products are so addictive, and it causes so much harm. Around like 7 million people every year are dying from tobacco around the world, and it's so important that this conference is happening today in South Africa, on the African continent, because it sends a really strong message that tobacco control is very important in this continent.
I mean, you look at, we were chatting a little bit earlier with Flavia, who is, of course, the president first time, and I have to acknowledge the fact that she's the first female president that they've had in 50 years. She's amazing. I'm so proud of her. I think that's just something that we really need to celebrate as South Africans here. But on a side note, we look at the fact that there aren't proper statistics. I mean, you know, we sort of can say, yeah, 8.8 million people die annually globally from smoking, but how do we know that?
Yeah, well, a lot of this it's based on real evidence that we have in some countries, and it's based on, you know, a lot of estimates. And we work very closely with major partners such as Michael Bloomberg, who is here today, who is planning to be here today for this conference. He's WHO's ambassador for this kind of area of work of tobacco control, the non-communicable diseases. Monitoring the epidemic of tobacco is crucial, so people know how to respond. People know what kind of services are needed in place, and so governments know what kind of measures they should be really taking to protect people from the harms of tobacco.
Yeah, I mean, I'm reading a press release at the moment that's just been handed to me saying, you mentioned Michael Bloomberg, and Bloomberg Philanthropies today announcing that it'll provide $20 million in funding, a launch of Stopping Tobacco Organizations and Products, a new global watchdog that will aggressively monitor deceptive tobacco industry tactics and practices to undermine public health. I mean, this is a huge development.
Such initiatives are so important because because we see the industry taking so many different types of tactics and paths to convince people to still buy their product. On one hand, there's this promotion of different kind of new, novel products, supposedly, as alternatives to tobacco. But we know at the end of the day that the tobacco industry has a bottom line. They're making all these different kinds of products, all with the goal to make money. So these kinds of initiatives to understand the deception and the kind of tactics that the industry undergoes, it takes, are very, very important.
Yeah. One of the ways that we here in South Africa obviously try and reduce the amount of people that smoke is to try and make it too expensive. You see other countries where, I was hearing, perhaps I'm wrong, and maybe it's just a rumor that you can go to somewhere like Australia and pay 450 Rand. I'm converting it to rands for a box of cigarettes. Here we're still a little bit more affordable, but we do see them increasing every single year. And many saying that is possibly one of the only ways to stop people smoking is heavy taxation. Do you find that? Is that the only way?
We agree totally. Tobacco taxation, especially around excise taxation, is a powerful tool to control tobacco use, to protect people from the harms of tobacco, to make that product more expensive. At the same time too, placing more taxes on tobacco products, it generates revenue for the state. So you have the potential there with more finances to provide the kind of health care that people need, particularly those who are suffering from tobacco-related disease like cancer and heart disease, as you mentioned before. So tobacco taxation is such a powerful tool to protect people and governments and communities from tobacco.
Then why is it that we're finding that it's more poor people that are smoking in the poorer nations? Because it seems to be working in richer nations, from statistics that I'm reading, and yet in the poorer, more underdeveloped countries, smoking continues and the death rate gets higher.
I think a lot of this often comes down to the level of government control that's in place. So the tobacco industry, like you said, it's quite deceptive, and it knows how to enter markets that have weak regulations and controls. So invariably it's maybe more developing countries that have less powers, let's say, to protect against tobacco, and they exploit that. They exploit these opportunities to enter into markets where that they can more readily.
Yeah.
So WHO is all about pushing regulations around marketing bans, smoke-free places, for example. There's a whole range of measures that governments can readily take that don't cost anything, that can go ahead to make and create a beautiful place. It's been great being in Cape Town to see, from what I've noticed, lots of a very healthy way of life, and I think tobacco control really promotes healthy living. So,
well, it's quite ironic that where we're broadcasting from is usually the smoking balcony here at the Cape Town International Convention Centre. We normally stand here and all the smokers are here, leaning over, having a look outside and having a cigarette. This is now a non-smoking area, as you can imagine, during a conference like this. Thank you for talking to us.
You're welcome.
I hope it really goes well. It's an absolute pleasure. I hope it goes well here. From the World Health Organization, Paul Garwood, talking to us a little bit about some of the things that the World Health Organization has found through their work with tobacco. I promised you those numbers, and these numbers are absolutely frightening. At the beginning of the program, I asked you, how many cigarettes do you think have been sold globally, and what do you think has been the number of that's been generated by these tobacco companies? Well, here's that number. The cigarette industry sells 5.5 trillion cigarettes a year. That's the number from last year. 5.5 trillion cigarettes, with a generating revenue of $700 billion. That's a lot of money. With all this education that's been around, and with so many people dying of lung-related diseases from smoking, that number seems to just keep on getting higher. We take a break. See you after this.